Hi, I'm Kathy
Okay.
Wong.
Oh, wait.
Uh,
I pushed again. Okay, right. Oh, I did.
oh my goodness. Okay, I'm Kathy Wong, aka I'm doing category 1. So first I'm going to have an indicator muscle. I'm going to use the hamstrings and it's strong. Now I'm going to ask the patient to do the sedation point, which is the MCP of the second digit, and it's weak. And then we're going to do it without the sedation point, and it is strong. So now we know that's a good indicator muscle. So now I'm going to have the patient TL both SIs at the same time, and it's weak, but now we got to isolate which SI. So put two hands on one SI, and it's weak. And just to make sure, let's do the other SI, and it's strong. So now we know it's the left SI that is weak, and usually with Cat 1, it is a rib tenderness on the same side, which in this case, Matt says yes. So now we're going to do a rebound challenge, the PSIS and the ischium. Okay. And it is weak here, and it is strong. So since it was weak on this side, I'm going to do pelvic blocks 45 degree to the spine. So for here, I'm going to have it on this side and this side. So now I'm going to recheck the rib on the left side, and Matt says it went away. So now I'm going to do a pumping assist on the right ischium for 10 times or until I feel a release and a release. So now I'm going to ask Matt to TL the left SI with both hands. I'm going to recheck the muscle, and it is strong, and I'm going to remove the box and recheck the muscle, and it's strong. So that is Cat 1. Now we're going to do Cat 2. I'm going to ask the patient to turn supine, and I'm going to do indicator muscle, which is going to be the rectus femoris, and it's strong, and the sedation point is inside the elbow. Check it, it's weak. Now I'm going to ask no sedation point and recheck the rectus femoris, and it's strong. So now we know that's a good indicator muscle. So now I'm going to ask the patient to TL one SI at a time. So he did the left SI, I'm going to test, and it's strong. I'm going to do the other SI, and it is weak. So now I'm going to rebound challenge one SI, then the ischium. So do here, and it's strong. I'm going to do here, and it's weak. So now we know it's the right side that is the weak one. So now we're going to do pelvic blockers, 90 degrees to the spine. On the weak side, I would put it on the PSIS, and on the not weak side, I would put it on the ischium. So now I'm going to ask him to TL the weak side, which is the right side, and rectus femoris, and it's strong. And I'm going to leave it the blocks there for a second, and then I'm going to take them out and recheck, and it is strong still. So that's Cat 2. Cat 3, I'm going to use the indicator muscle. It's going to be the sartorius. So resist. Okay. And now I'm going to, the sedation point is going to be your wrist on the ipsy side, and it's weak and no sedation point. And now it is strong. So now we know that's a good indicator muscle. The TL would be the symphysis pubis. So I'm going to ask you to put your hand there, below your belly button, and I'm going to test it, and it is going to be weak. So now we're going to rebound challenge the PSIS and the ischium at the same time. Here, it's strong, opposite side, and it's weak. So now we know this is going to be the weak side. So now we're going to place the pelvic blockers on the weak side. So since this is weak, we're going to put it 90 degrees to the spine here, and opposite ischium, here. And now we're going to do a short leg, long leg test. So here, okay, so on the left side, it's going to be the short leg. So it's going to be the short leg. So now I'm going for short leg. I'm going to do medial and then lateral and then back to medial. And I'm going to do that 3 times gently like this. Go. And then for the long leg, I'm going to go lateral to medial and back down. Lateral to medial and back down. And one more time. Lateral to medial and back down. So now I'm going to ask the patient to TL their symphysis pubis again. And I'm going to do sartorius test. It's strong. I'm going to take the blocks out. Sartorius test again. And it is strong. So that is Cat 3. That's Cat 2 SP. Cat 3 is going to be prone. So I'm going to have an indicator muscle. That's going to be the hamstrings. Okay. It's weak. It's strong. And then I'm going to, so for Cat 3, it's going to be lumbar. So I'm going to press right here and then test again. And it should be weak. And test again for hamstrings, and it's strong. So now we know that's a strong indicator muscle. There is no therapy localization for Cat 3, but I'm going to do a rebound challenge. So I'm going to go to L5, and I'm going to rebound challenge with the opposite ilium. So here, and then I'm going to test, and it is weak. I'm going to do this side, go, and it is strong. So we know on the weak side, we're going to place the blocks 90 degrees to the spine. So it'll be here and here. And now I'm going to do L5 spinous pain check. And the pain went away. So since the pain went away, we're going to move the block. And then we're going to do, since this has to do with the sacral vault, we are going to, for hands on the for expiration, we're going to gently put pressure on the apex, and that's for inhalation. For expiration, we're going to put pressure on the base. Okay. Sorry. I was supposed to keep the blocks in. Okay. So, inhale, exhale, inhale, exhale. Okay. So now we are going to rebound challenge and check the indicator muscle again. It's strong. Take the blocks out. Check it again, and it is strong. And that's pelvic category 3.
Push that again.